success. So with that, I'm happy to stand for questions, and Dr. Davenport. By the way, before I close, Dr. Weisman, did you want to add anything?
I would just add that this wearing face coverings is incredibly important. And as we have Father's Day coming up, and as we have July 4th coming up, we need to not have people having those family barbecues, when outside your household. It is still incredibly important that we keep our physical distance from each other. And, the way we do this is we limit the number of people we have contact with. So while I know it is, some great weather, and these are times when we want to be spending time with family and friends, it is simply too dangerous to be doing that. So we need you when you're out in public for essential services to be wearing those face coverings, and we need you to pay attention to all the other hygiene and physical distancing issues we talked about. That is the way we're going to stop this. That is the way we are going to slow the spread of this. And if you have any symptoms, get tested. If you're positive, stay home, stay away from others, because really, as we're seeing, this is exploding. And it is overwhelming our healthcare system locally. And it is just too dangerous to live our life as if this pandemic is not around.
Thanks for your work and your help. By the way, we had Dr. Scott Lindquist in Yakima for several days, a week or so ago, and he has helped us with a strategic plan for Yakima. A part of that is that we are forwarding over $6.5 million to Yakima to help with some of the health district needs there. We have trained about 1,000 contact tracers that are available to do the contact tracing. And we were working very closely with your health district to make sure those jobs get done. So with that, happy to stand for questions. You can direct them to any of us.
Great, thank you, Governor. First question comes from Don with the Yakima Herald Republic. Don, if you would like to unmute yourself, you can ask your question.
Thank you. I have questions for Governor Inslee and Dr. Davenport. Given the current situation, Governor, are there plans to reopen the former Astria Regional Medical Center and use that to expand the number of hospital beds that are available?
Dr. Bono, would you like to address that?
Yes, thank you, Governor, and thank you for that question. One of the things I would like to highlight is Virginia Mason did an exceptional job in expanding their capacity, and what Dr. Davenport described now is that in spite of expanding that capacity, they've had to transfer patients out of the area, out of Virginia Mason. What we've done in our previous work with regards to taking care of patients in any kind of surge is to work across the state with other hospitals to make sure that we've got sufficient ventilators and ICU beds and acute care beds for any potential surge. Astria will likely not be reopened because we have sufficient capacity. And one of the things when we were there in Yakima earlier this year, we realized that in order to have the Astria facility stood up, we would need to have additional personnel that we did not have within the county. And we would not be able to transfer personnel or supplies to Astria. Our better opportunity in supporting any kind of surge was to optimize all of the capacity across the state.
And Governor, as you know, the mayor of your former hometown has already said that their city employees will not enforce any orders regarding social distancing and such. And basically, is that going to have to change with your order on masks?
Well, I met with the mayor the other day, along with the mayor of Yakima, Commissioner Baker, and the Chamber Council, and she was very supportive of masking. She made it clear that she thought that was an appropriate strategy. So I'm hopeful that she will help in this effort. And we need all the leaders to pull together on this. But We've now distributed about, I think, over 200,000 masks, and we have the Chamber of Commerce has a Mask Up campaign. The mayor of Sela and the mayor of Yakima are very supportive of that, and we appreciate that. So I'm hopeful that this issue of masks is something we can be unified around, and I think we are, listening to the leaders I've spoke with so far, because it allows us to go about our business. It allows us to do shopping. It allows us to do the things we kind of normally would do. We just wearing a face covering. Just one comment on the mask too, that this requires a face covering. It doesn't require a specific kind of mask. So it's something that everyone actually can comply with. So I will look forward to the cooperation of the mayor of Sela, and she's indicated, I believe, that she will help us continue this effort. And I want to thank the leaders of Yakima who have done that already. The city, the county, the chamber have already on their own nickel started a public campaign. We will also have a state alliance with that, with a communications campaign on television, radio, and the like to help people understand the benefits of this. So they will hear this both from the county and the cities and the chamber, and also from the state of Washington. So I think there'll be an alliance on this.
Thank you. And for Dr. Davenport, the transfers from Virginia Mason, are they primarily COVID patients or non-COVID patients, or a mixture of both?
Thanks for your question, Don. Those patients are a mixture of COVID and non-COVID patients. You know, one thing I think that we thought early on was it was going to be a space and an equipment issue that was going to be our big challenge. But what we're really seeing is that the care of COVID-19 patients actually requires more workforce. It's much more intensive. So even though we actually have physical capacity at Virginia Mason Memorial, we simply don't have the workforce to continue to care for those patients safely. And that's why we're transferring patients. And that means, unfortunately, that when someone comes to the hospital and requires hospitalization, whether it be COVID or something else, many times we determine that we can't take care of them and need to transport them via ambulance or by air to other hospitals.
Great. Thank you, Dr. Davenport. Our next question comes from Joe with the Seattle Times. Joe, if you can unmute yourself, you may ask your question. Okay, it looks like we can't hear Joe. Joe, if you would like to email me your question, I can ask it. Our next question comes from David, also with the Seattle Times. David, if you would like to unmute yourself, you may ask your question.
Hi, can you hear me?
Yes.
Hi, Governor. Sorry for asking an off-topic question, but I wanted to get your thoughts on the state of the CHOP in Seattle. As you may know, there was 2 people were shot last night at the CHOP. 1 person is dead. I'm wondering if you think what you think should be happening there now, if the city should change course in any way, or what are your thoughts on the situation?
Well, listen, it's you know, it's just so saddening to hear of any shooting anywhere across our state. Unfortunately, it happens in many places, and it's equally tragic in that area. Clearly, we need to have a way to provide adequate police and fire protection everywhere in the state of Washington, including in that area. So I do not have the full circumstances. I've not had a chance to talk to the mayor yet. I know she's very busy. But we have to have a way to provide services to people, everyone, no matter what stripe you are or political persuasion or whether you're a protester or not. We have to be able to have adequate protection. So I don't know the circumstances. I don't know whether that was an issue or not. It may not have been, but we've got to make sure we find a way to do that.
Great, thank you, Governor. David, would you like to ask a follow-up?
Sure, I appreciate it. Do you know, the area kind of was established because the Seattle police left their precinct there. Do you think they should try and return to that precinct?
Well, I think my understanding is the city is having discussions with the community on a whole host of issues, how to provide additional community services, how to provide police services. I certainly believe that we have to find a way to simultaneously have the community believe they have a chance to speak, and for police services and importantly fire services to be able to be provided. And my understanding is that there was some progress being made to make sure that that has happened. I don't know the circumstances, obviously, of this yet. There may have been an adequate response. I don't know that. There are some reports that there was not. We'll have to get more reports to figure that out. But one way or another, we obviously have to be able to provide protection for people of all citizens everywhere in the state of Washington, including in that particular area. So I heartily believe that's a necessity.
Great. Next question was emailed to me by Kate with the Chinook Observer. How will the state enforce virus-safe conditions with orchardists and growers for fruit pickers and packers as we enter harvest season?
Well, if I can talk a little bit about that, we have embraced quite a number of measures to protect workers, particularly in agriculture. We have a specific rule in place about that has a host of requirements regarding necessary housing conditions, cohorting of people during transportation, hygiene, access to cleaning facilities and the like. And those are legally binding requirements and they are enforceable. Employers have legal obligations and there are sanctions if in fact those are not followed. Now, as we go, we will continually to assess these as well to find out if they're adequate. And I think that that's kind of instructive to us as we fight this virus, that we learn, we get smarter, we find out what works or what does not work. And what we have found in this case is that masks work. And so that's why we're embracing them on a broader perspective. And I think that that's what we have to do is to get smarter every day how to fight this virus. It's a very dangerous virus, but we ought to be smarter than it. And we ought to be willing to do the things that we know that work as we learn what works. And we've learned masks that works. So we intend to use them. John, do you want to add anything to that?
That's great. Thank you, Governor.
Next question comes from Dan with Fox News. Dan, if you would like to unmute yourself, you may ask your question.
Yeah, thank you, Governor. This is another off-topic question. I apologize for that. But as far as the CHOP, it sounds like you do believe that police in Seattle should get back into that East Precinct at some point. You also said that you think that people should have a place to protest. But I want to know what you think the governor's role, your role is in facilitating that, because right now the city of Seattle seems to be willing to allow the status quo. And as you heard, there's now a 19-year-old man dead and another man fighting for his life. And I want to know what you think the governor's role, your role in providing the ability for the police to get back in that precinct and police the area, frankly, because they were not allowed to police the area last night.
Well, I don't know that. I've heard some concerns about that. So I'll look forward to people giving me the actual facts when an investigation is done. Here's what I think. First off, I am governor and my role is supportive, if you will, to the entire city of Seattle and its democratically elected government. Obviously, I am not in charge of the Seattle Police Department or the Seattle Fire Department or the Seattle Department of Transportation. So those are things under the control of the Seattle city government. But we can play a role in supporting things that Seattle asked for. As far as what happens in the precinct, that's really a decision for the city of Seattle. I just know this. We have to have a way to provide police services and fire services in that area. Now, whether it's from that building or using some other building or mobile command posts or something else, that's for the city to figure out. I just know that we have to be able to respond when there are injuries. Now, if that is not the case right now, then we need to explore some other option in that regard, because that is something the state obviously needs to see happen.
Great. It doesn't look like I got a follow-up question from Joe with the Seattle Times. So if there are no other questions in the chat, Governor, would you like to give any final remarks on Yakima?
I just want to tell you that I feel, I have such a feeling for people in the Yakima Valley. I feel we want to stand with them. We just can't allow them to be swamped by this virus. And I know in order to stop that, all of us have some role to play. And I hope people will all pitch in. If we all pitch in, I believe that we can rescue this valley. And we're stepping in and doing that today. And I know there's a lot of people that want to open up small businesses. We're talking to small businesses about that. But today, this is one thing we've got to do today. Time did not allow us to wait any longer. With that, thank you very much. I hope everybody washes their hands and mask up. Thank you. Are we clear?